Hello, everyone. My name is Julia Slanina. I'm the founder and CEO of Treehouse. Today, we are excited to have another fantastic speaker join us today to talk about an important topic, which is VBAC. VBAC stands for Vaginal Birth After Cesarean. And today, joining me is Dr. Jessica D. She is currently the medical director of maternal, newborn, and women's health at the Ottawa Hospital here in Ottawa, Ontario. And she's also the former head of the Division of General Obstetrics and Gynecology. Her research interests also include labor management, induction of labor, cesarean section, and vaginal birth after cesarean, or how it's known, VBAC. So she's here today to answer some of those questions about C-section and VBAC, and we are very excited to have you today. Thank you, Dr. D.
You're welcome. Thank you for having me.
So let's jump right into the topic and really introduce what it is. What is VBAC? What is vaginal birth after cesarean?
For sure. So it is a state when women who have had a previous cesarean section are now in their subsequent pregnancy, and they're having to make a decision for the plan for birth for this current pregnancy. So in most cases, most women have the option of having a vaginal birth after a prior cesarean or having a repeat cesarean section the second time around.
Okay. Now, should I have scheduled a repeat C-section, or should I try if I'm having a second child? Should I try for VBAC?
So both are pretty good options, and it may be dependent on a particular situation or a case. So for most women, both are reasonable options in the sense that the risks are fairly equal, different for each option, but it's worth discussing what the pros and cons for each birth option would be for that particular woman.
Okay. Are there any risks associated? So when we're discussing these pros and cons, maybe if you're sitting down with a patient or a family, you can talk about those risks associated with VBAC, repeat C-sections. What happens? What are some of those questions?
For sure. So let's start with a repeat cesarean section. Okay. So anytime someone's had a previous C-section, their option is to plan ahead and schedule a repeat cesarean section. So for some women, that is that is what they want. It's more convenient for them. They know exactly what's coming up, when's coming up. They can arrange for childcare for their other child at home. And it also carries less unknowns and it has more predictability. So that is a very attractive feature for a lot of women, especially if their first cesarean was fairly straightforward. They had a good recovery. There were no complications. A lot of women actually like that option. But then, of course, there's always the surgical risks that are involved. And for the mom, having a second surgery is usually more risky, more potential for risk. So these things could include, more infection risk, more bleeding risk, and of course, the recovery after surgery as compared to a straightforward vaginal birth is usually a little bit longer and there's more pain involved. Mm-hmm. And with a repeat cesarean section, we also think about subsequent pregnancies, which usually means that after having 2 cesarean sections, then you're at that point more committed to having repeat cesarean sections if a family chooses to have more than 2 children at home. And that in itself carries other risks of long-term things like placenta previa, placenta accreta. Okay. So that's the repeat cesarean section option. With regards to a vaginal birth, what I usually say, it's a trial of labor after cesarean, or what's currently known as TOLAC, TOLAC. Because when you have a plan to labor with a goal of having a vaginal birth, the potential for needing a cesarean section is still there. So that is the risk that someone who wants to have a VBAC plans a TOLAC is accepting, meaning they go down the road of labor just like the first time, and 80% of the time it may end up with a vaginal birth, but there's that 20% chance that they may still need a C-section for whatever reason, and that could be labor related reason, that could be baby reasons or could be maternal reasons.
Mhm. Is there a particular type of candidate that is a bit better for VBAC? We if a patient comes in, and we hear many doctors always talking about, we offer very personalized care, individualized care specific to that particular case. Are there some individuals that are good candidates and others who may not be?
Absolutely. So we talk about, for all comers having a VBAC, the general things that would be more favorable or where they have a higher chance of having a vaginal birth after laboring would be if they had an average size baby, if they went into labor on their own, and if their labor was progressing without any intervention or medical help. So those things are usually outside our control. So those are usual labor or obstetrical related factors. In terms of their past history, if they had their first cesarean section because, for example, they went into they were preterm and the baby was in a breech position, for example, or they had a placenta previa, things that are not necessarily recurring, meaning the chances of that happening the second time around is a lot lower, then they're a reasonable candidate to have a TOLAC or a trial of labor. Now, the things that would make someone not be the ideal candidate,
exactly. The opposite.
yes, the opposite,
Yeah.
would be if they had a vertical or an up and down scar on their uterus, and that's usually called the classical cesarean section, or if they've had multiple surgeries, they've had 2 cesarean sections before, or if this pregnancy they have hypertension, other complications in the pregnancy, or they're needing to be induced. So, and the reason we said that they're not the ideal candidate would be either because the risks are slightly higher than the average risk, or if their chance of having a vaginal birth is lower than the average person going into labor.
Understood. Now, if the individual is a good candidate, and we've already, gone through that protocol to assess that, what should I know if I want a VBAC?
For sure. So if you want a VBAC, the things that you need to consider are the risks associated with this labor, which is slightly different than a labor for a first-time mom. Right. So these risks would be because you've had a scar on that uterus. The main risk that we talk about, and a lot of the conversations revolved around this risk, is that of uterine rupture. And that is when that scar on the uterus is usually weaker. And as they're going through labor and contractions, that area may open up. And if that area opens up, it can lead to serious consequences such as major bleeding for mom. It could affect the blood flow or oxygen flow to baby, and potentially cause serious health concerns for the baby. And in that situation, mom would usually need an urgent cesarean section.
Okay.
So that's the main thing. But other factors that one would want to consider going into labor with a trial after a cesarean section would be optimizing labor this time, optimizing their chance for a vaginal birth. So these would be, hoping that there is no reason that they would need to be induced. Hopefully they don't go into way past their due date. And things like promoting the normal labor process. So being kind of moving around during labor when it started. We call that ambulating, right? Being able to move around, having good rest. If they need pain management, there are many management options, both in the early phase and in the more active phase of labor. An epidural is always an option. And just like I would always say, it's just like going into labor the first time. You want to optimize that labor so that someone has a vaginal birth.
Of course.
And what's important is that during this process, because of that risk of uterine rupture, we always want to monitor 2 things. One, their labor progress, wanting to make sure that they are going through that process in the ideal manner, meaning they're changing, their cervix is changing, the baby's coming down. And the other important piece is that we are monitoring babies heart rate pattern, because that reflects how baby is tolerating this labor.
Okay. And speaking of that, mom or family might be wondering the chances of success. Obviously, we are in a health system that is quite optimized at success rates, and we have good care teams. But that's still a risk sometimes, and someone might want to know what success rate is.
Yeah. So again, I use this as an all-comers, right? Without regard to specific circumstance around the baby size, around mom's height and weight, and the gestational age. But overall, the chance for someone having a TOLAC,
Mhm.
going through labor, and having a vaginal birth is in the range of 70 to 80%. And I
Mhm.
would say that's about the same rate that someone with their first pregnancy going into labor would have a chance of a vaginal birth between 70 to 80%.
So it's
Which
relatively on par
the
then.
odds
Yeah.
are in our favor of
Yeah.
having a vaginal birth. I also like to, I have changed the way I've used these terminology. And,
Mhm.
and a patient actually pointed that out to me, is that we are so used to saying a successful VBAC, right?
Mhm.
And the VBAC is a VBAC.
Yeah.
It's and the opposite is that it implies there's a failure somehow.
Yeah.
And so I've really shied away, or I've really changed
I
the
don't like
way I
that word
use
either.
that word. But it's everywhere, and I'm like really slowly trying to educate, all our learners and our healthcare providers or nurses to try to remove that word, because a vaginal birth is a vaginal birth, and the opposite is that of a repeat cesarean section. It's not a failed VBAC.
No.
Both are good birth outcomes.
And that sounds very intimidating, especially if you're a mom or someone who is already nervous. Maybe even right now we're going through still COVID restrictions, and so many moms and families have had to labor alone. And so that could be kind of daunting and intimidating for them.
Exactly. So I typically going into, their pregnancy, as we get closer and closer to their last month, we tend to talk about it more. And I like to prepare them for both possibilities,
Mhm.
in both settings. So if someone chooses, say, to have a planned repeat cesarean section, I still talk about that event that they may go into labor ahead of their scheduled
Right.
C-section.
Yeah.
What would their plan and their wishes be? Because in that setting, as long as there are no contraindications and no added risks to her or her baby,
Yeah.
she may entertain the possibility of going into labor. And if you've talked about it, it's not as fearful an experience, hopefully, for
Right.
that person, because they're
Yeah.
caught off guard. Their water breaks and then suddenly they're in labor. That wasn't in the plan, right?
Yeah.
I always talk about that possibility. It's the same way for the other
Mhm.
setting where someone is really motivated, they want to have a labor and a vaginal birth,
Mhm.
but they may go a week past their due date or
Mhm.
2 weeks past their due date, and then now what? So I always talk about having a plan B, so they're not setting themselves up for a disappointment, because that's the reality, that a lot of things are beyond our control.
Absolutely. I can attest to that with my labor as well. It didn't go as planned at all. Um, so if I do plan to have a VBAC, and this is, I've looked at all of my options, can I still have a home birth? And home birth
So
is something that, some people feel very comfortable with. So
it's a very good question. Certainly, based on what we know around labor and VBAC and uterine rupture risk, is that the chance of that happening is very, very low.
mhm,
However, if it does happen, things can change really quickly.
mhm,
And so ideally, the recommendations are to have ongoing continuous monitoring of the fetal heart rate, because it's often the first sign to us if something was going wrong, whether it's a partial or the beginning of a uterine rupture, or any other labor related reason that the baby's not tolerating labor. And you'd want to monitor the baby's heart rate when someone's in active labor, and especially in the second stage when they're pushing. And in that setting, if there was an indication that things aren't going well, we want to be in a situation where you have the ability to go to an urgent cesarean section, meaning having the facility in an operating room to have the anesthetist and the operating team to be there as fast as possible.
Okay, that's understandable. What if the patient needs to be induced? What happens in that case?
Yeah, very good question, because that is a very common situation. And I'd like to say that the common reasons that someone may need to be induced in this setting would be if they go past their due date or if their water breaks, right? And they haven't gone into labor. We're not going to talk about all the other potential complications in a pregnancy because that's a whole conversation in itself. But if you're needing to be induced, there's some options. So we always talk about induction agents or medications. So these are prostaglandins or oxytocin, and they are associated with an increased risk of uterine rupture because the way they work is it really creates stronger and more regular contractions. So we tend to not use those in this setting. What we would offer in someone wanting a VBAC is either a Foley catheter induction, where it's a mechanical way of getting that cervix to ripen. And by that, we mean, trying to get that cervix to get to a good 3 or 4 centimeters dilate, to thin it out, to bring that head down. And then once you get to that point, if they're not in labor on their own at that point, then we would offer to break their water. So those are the two often the two ways that we would induce someone who's had a previous C-section.
Dr. D, we're coming to the end of our line of questions. And so before we close up, I just wanted to offer you the opportunity to share anything that you'd like to share with our listeners or viewers on this important topic.
Yes, for sure. So the message that I would like to send out there is that both are good options. There's never a one size fits all, right? So if someone was motivated, they want to try labor and have a vaginal birth, as long as there are no health risks, added health risks to them, absolutely discuss this with your healthcare provider and talk about how you can optimize your outcome. But also for women who are wanting to have a repeat cesarean section, there's nothing wrong with that as well, because there's this sense that there's this social pressure to want to need to labor and have a vaginal birth. But the messaging is you have to figure out and plan for what's right for you in your situation. That could be either or both options.
Well, thank you very much. And we thank you very much for your expertise and for all the questions that you've answered today. Dr. Jessica D is the current medical director of maternal, newborn, and women's health at the Ottawa Hospital in Ottawa. So thank you for being on our webinar. And we look forward to hearing more on other topics. Thank you.
You're welcome. Thank you.